What is malaria and how it is transmitted? Malaria is a life-threatening disease primarily found in tropical countries. It is both preventable and curable. However, without prompt diagnosis and effective treatment, a case of uncomplicated malaria can progress to a severe form of the disease, which is often fatal without treatment. Malaria is not contagious and cannot spread from one person to another. The disease is transmitted through the bites of female Anopheles mosquitoes. 5 species of parasites can cause malaria in humans, and 2 of these species, Plasmodium falciparum and Plasmodium vivax, pose the greatest threat. There are over 400 different species of Anopheles mosquitoes, and around 40, known as vector species, can transmit the disease. This risk of infection is higher in some areas than others depending on multiple factors, including the type of local mosquitoes. It may also vary according to the season, the risk being highest during the rainy season in tropical countries. Who is at risk of malaria? Nearly half of the world's population is at risk of malaria. In 2021, an estimated 247 million people contracted malaria in 85 countries. That same year, the disease claimed approximately 619,000 lives. Some people are more susceptible to developing severe malaria than others. Infants and children under 5 years of age, pregnant women, and patients with HIV/AIDS are at particular risk. Other vulnerable groups include people entering areas with intense malaria transmission who have not acquired partial immunity from long exposure to the disease or who are not taking chemopreventive therapies, such as migrants, mobile populations, and travelers. Some people in areas where malaria is common will develop partial immunity. While it never provides complete protection, partial immunity reduces the risk that malaria infection will cause severe disease. For this reason, most malaria deaths in Africa occur in young children, whereas in areas with less transmission and low immunity, all age groups are at risk. Where is malaria most prevalent? Malaria occurs primarily in tropical and subtropical countries. The vast majority of malaria cases and deaths are found in the World Health Organization African region, with nearly all cases caused by the Plasmodium falciparum parasite. This parasite is also dominant in other malaria hotspots, including the World Health Organization regions of Southeast Asia, Eastern Mediterranean, and Western Pacific. In the World Health Organization region of the Americas, the Plasmodium vivax parasite is predominant, causing 75% of malaria cases. The threat of malaria is highest in sub-Saharan Africa, and 4 countries in that region accounted for nearly half of all malaria deaths worldwide in 2021. Nigeria, 26.6%, the Democratic Republic of the Congo, 12.3%, Uganda, 5.1%, and Mozambique, 4.1%. Is there vaccine against malaria? RTS-S/AS01 RTS-S is the first and, to date, only vaccine that has demonstrated it can significantly reduce malaria in young children living in moderate to high malaria transmission areas. It acts against the Plasmodium falciparum parasite, the deadliest malaria parasite globally and the most prevalent in Africa. In 2019, Ghana, Kenya, and Malawi began leading the introduction of the vaccine in selected areas as part of a large-scale pilot program coordinated by World Health Organization. To date, the program has shown that the RTS-S vaccine is safe, effective, and feasible to deliver through routine immunization services. As of March 2023, more than 1.3 million children had received at least 1 dose of the vaccine through this program. 29 countries in Africa have expressed interest in adopting the malaria vaccine as part of their national malaria control strategies. In October 2021, World Health Organization recommended the use of the RTS-S vaccine for children living in areas with moderate and high transmission of malaria. The recommendation was informed by the full package of RTS-S evidence, including results from the ongoing pilot program. The World Health Organization (WHO) has recommended a new vaccine, R21/Matrix-M, for the prevention of malaria in children. The recommendation follows advice from the World Health Organization, Strategic Advisory Group of Experts on Immunization (SAGE), and the Malaria Policy Advisory Group (MPAG), and was endorsed by the WHO Director General following its regular biannual meeting held on 25 to 29 September. The R21 vaccine is the second malaria vaccine recommended by World Health Organization, following the RTS-S/AS01 vaccine, which received a World Health Organization recommendation in 2021. Both vaccines are shown to be safe and effective in preventing malaria in children and, when implemented broadly, are expected to have high public health impact. Malaria, a mosquito-borne disease, places a particularly high burden on children in the African region, where nearly 500,000 children die from the disease each year. Demand for malaria vaccines is unprecedented, however, available supply of RTS is limited. The addition of R21 to the list of World Health Organization recommended malaria vaccines is expected to result in sufficient vaccine supply to benefit all children living in areas where malaria is a public health risk. Malaria-free countries in World Health Organization African region. Currently, World Health Organization certifies Cabo Verde as a malaria-free country. Cabo Verde is the third country to be certified malaria-free in the World Health Organization African region, joining Mauritius and Algeria, which were certified in 1973 and 2019 respectively. Malaria burden is the highest on the African continent. Don't forget to subscribe the channel.